Dear ladies and gentlemen, today we want to introduce our 10 rules of the Düsseldorf miLens strategy to correct presbyopia with intraocular lenses. Why do we urgently need a new MIL strategy? International studies show that the patient happiness MIL implant is over 90%. They enjoy a better quality of life, and even over 90% would recommend them to a friend. But if you have a look at the facts, you can really see the MIL dilemma. Nevertheless, the international MIL implantation is only 1 to 5%. And multifocals, on the other hand, are the most common cause for IOL explantations. So let's have a look at rule number 1 of our Düsseldorf miLens strategy. That's a patient wish. It's very important to really analyze the patient's wish, as we are all very different, have different needs. Never ever push the patient to have an MIL or EDOF IOL implanted. Try to explain all the advantages for his quality of life with MILs or EDOF IOLs. Never ever hide visual side effects like photopic phenomena, and document all this with the signature of the patient. Rule number 2 is have a good pre-examination protocol that is always followed through by your assistants. MIL surgery is a really refractive surgery, so only use the newest diagnostics. So let's get to rule number 3 of our strategy. It's the visual history and kind of, I call it psychoanalysis. It is very important to ask what is your most important distance with those glasses, because that's where the patient really doesn't want to lose vision. Then ask him for special visual needs in job and hobbies, or if they're a hunter, it's extremely important that you do surgery to the right eye, especially the dominant eye. Does the patient have any risky sports? And how is his photopic phenomena tolerance? You have to talk upfront about those subjects. And this again has to be matched with a kind of psychoanalysis. There's a very nice publication from Meester that you can read through and that can guide you. So if somebody is over competitive, or if he is very narrow-minded, or if he's very eager, or those patients usually are very critical. Those patients usually are not perfect for MILs, because they will always emphasize the downsides effect of the IOL. So on the other hand, a question I do ask my patients, are you more a pragmatic generalist, which I think those are very good for MILs, or more dogmatic perfectionist? That's the two different sides of a coin. And this helps even the patient's disimplification to judge themselves. Rule number 4 of the Düsseldorf miLens strategy is an informed consent and shared decision making. So what are the landmarks of a good informed consent? It is very important, and I like to repeat myself here to emphasize disadvantages, downsides, because it's a lifetime decision for the patient, and he has to know about possible disadvantages. And on the other hand, do not hide uncomfortable facts. As we all know, 1 to 5% of our MIL patients need touch-up procedures. So if you ask for money, you of course upfront have to explain that there will be touch-up procedure costs. What is very important to understand in shared decision making is that the patient only understands what you explain easily. So as you can see on the right hand side, we often use different displays to explain it to our patients. Rule number 5 is use charts, as I already mentioned, and make sure the patient really understood what you were talking about. So one question I really do like, and you will be surprised, it's only 2 simple questions what some patients answer. One question is, what are you able to see without glasses after surgery? And the other one is, what are the visual disadvantages and challenges for you after surgery? So patients should be able to answer this. If they're not able to answer this, your understanding making process to the patient has to be reviewed. So rule number 6 of the Düsseldorf miLens strategy, we do employ refractive managers that are guided by a checklist. And we think it's really important that you have a nice quiet ambience and time, no noise, no rush, so that your refractive managers can really explain what you will do to the patients. And on the other hand, patients dare to ask a stupid question. There is none, but that's how they look sometimes at themselves. To ask a stupid question to a refractive manager, way easier than a doctor. So the checklist I already mentioned, I think is important not to forget anything. And then again, the signature under the sentence, I understood everything and had time to ask. Because at that moment when the patient signs this, he knows, okay, now it's time to really understand. Rule number 7 is about giveaway brochures and publications and contact data to the patients. We use company brochures, we use our own or other persons' publications, and my patients always have a business card of a contact data or contact person. Rule number 8. As MRL surgery is refractive surgery, we only use the newest surgical techniques. For example, for the astigmatism management, the cyclotorsion controlled marking of the CCC with a lens or laser. And also mentioned in many publications is that cataract refractive surgery should only be done by experienced surgeon who can cover his intraoperative complications and foresee the further process of refractive surgery. So what you need is an experienced high-volume refractive surgeon, not only cataract surgeon who is able to do all possible touch-up procedures. Rule number 9. The Düsseldorf miLens strategy is a standardized follow-up. So this may sound trivial, but I want to see all my patients 3 months after surgery, because then when the neuroadaptation process is over and when the lens is stable in the capsular bag, and even in some multifocals, even the first PCO appears. So the questions I always ask my patients after 3 months is, did we succeed fulfilling your visual needs? So last but not least, rule number 10 of the miLens strategy is about complaint management. I always had a good experience with a LEAP strategy, which works even if you're under stress, because it's very easy to remind. The first thing is listen to the patient, empathize, then apologize, and never ever forget the problem solution before the patient leaves your room. Take the patient's needs for real and serious, and if you have an unhappy patient, see him again and again and again. This is the best strategy to take care of him, because that's what the patient wants to know and wants to be sure that you take care of him. Thank you very much for taking your time, and thank you very much for your attention.